remainder of the tube is.
My name is Alexandra Blacka, and I'm going to be basically performing primary medication through a mini bag.
Aspirate for stomach contents.
Basically, the first thing I'm going to be doing is checking my physician order. The doctor has ordered Rosefin 1 milligram IV daily. The patient has an infection and elevated white blood cell counts. I'm going to review my drug book to get familiar. Rosefin is to treat and fight bacteria. It's a 3rd generation cephalosporin. The recommended dose is 1 to 2 grams daily. Side effects are GI upset. More serious side effects would be Stevens-Johnson syndrome, seizures, anaphylaxis. The contraindications would be if the patient is allergic to capsaicin, penicillin, or any milk proteins. I'm going to be administering this intravenously over 30 minutes. So basically the available we have is Rosefin 500 milligram per 1 ml. My drug calculation would be 1,000 divided by 500 times 1, so we know we need 2 ml. Okay, so now I'm going to come to my drug room. I'm going to wash my hands, and I'm going to check the integrity of the medication. We have normal saline that's in date. It looks good. Rosefin 500 milligram per ml. The expiry date looks good. I'm grabbing my tubing, making sure the integrity of that is intact, and also our mini bag here. So I'm going to clean
let the patient know
using aseptic technique. I'm going to draw up 2 mLs.
Tell the patient that I would help them with the
So
oral
I'm
care
going to draw
every
up
2 to 3
air.
hours.
I'm going to put a clean needle on there.
The MG2 length and size, the type, color and consistency of the pH, client response to the procedure and the treatment instructions, records INO, and amount of pH value, like I said. So then I would get a call at the nurse's station
Get all the air bubbles out. Use the scoop method.
That the patient is having some trouble, that he is still
that's
nauseous.
2 mLs. For our flush, I'm going to be drawing up about 6 to 10 mLs of the normal saline. Again, a clean needle.
I would aspirate
trash
for stomach content. Check the
and it drops about 6, I'll say.
Looks good. Then I would withdraw
under air
along with the stomach content, and I would listen to the swishing sound in the upper left quadrant.
Inject the air.
I hear the sound, so that's good. Next, I would flush with normal saline. So I would withdraw 30 mL of normal saline.
It's a needleless device, so I would use the scoop method for that.
The line seems to be clear.
Okay, so I'm going to look at my bag. I know that it's 50 ml bag, and we're going to be infusing over 30 minutes, so and the drop factor is 10. So I'm going to do 50 divided by 30 times 10, and that's going to be 17 drops per minute.
I would perform
I'm going to clean my port,
and I would document how the patient tolerated the procedure. I would again document the pH level, records INO, amount of pH and value, client's response, type NG2 length and size, and time that I performed the procedure. How was that?
It's going to go into our sharps container. Going to mix the medication.
Okay.
Okay. I'm going to label my initials, the date, time, the patient, the room number, how many drops per minute, which is 17.
Because if it's green, as I said yesterday,
I'm going going to hook up my tubing now.
But if the patient just came from surgery, abdominal surgery, he may have, and he has an ED tube, he may, that's normal, he may suspect some bleeding, depending on the type of surgery. But
Spear that in there.
So the purpose of that is also,
Okay.
if you,
Now that I have everything ready, I'm going to go into the patient's room now
what's the difference?
with my medication administration
You have to
record.
chart how much you return.
Okay, so I'm knocking. Mrs. Jones, on a clean table. Mrs. Jones, my name is Alex. I'm a student nurse. Your doctor has ordered for us to hang some Rocephin. It's an antibiotic. Your white blood cell count was a little bit elevated. So I'm gonna wash my hands, put on clean gloves. Do you have any known allergies? No? Okay, good.
Is anyone in here a mentor?
I'm gonna check my IV site for any infiltration, phlebitis, anything like that. And I'm gonna check the patient's wristband as well. And what's your name and date of birth again? Okay. Any tenderness? Okay, it looks good. I'm gonna also label my tubing with the date, the time, my initials, patient's room.
I'm not listening to you, I'm just trying to think of where I want to
Oh, no, you're fine. No. Well, yeah, but I'm just gonna add it to the previous video that, after, so that was recording, right? Yeah. Should I put your gloves on? Yeah, that's how you were, let's see how you do it.
I'm gonna
I
squeeze
said
this
how the
halfway.
patient tolerated
There's
the
too much
procedure.
Yeah, I don't think that's like that will.
I'm going to unclamp and prime it to make sure there is no
Yeah, just
blockage.
make a little, just make another one. Did you delete the other ones?
No.
Make sure there's no air bubbles.
I hate watching myself in the video.
Yeah, me too.
I
I
gotta
look like
take
that.
off my cap.
No, I
And we're
prefer,
good. I'm gonna clamp that.
and then I'll take it off, yeah.
I wouldn't let so much run out because I don't want to waste it. Okay.
And
Now
after I flushed with a
I'm
normal
going
saline,
to
I would,
make sure it doesn't touch
pull
anything.
back.
I'm going to come over and I'm going to
30
flush the
mL.
tube
So that would
with
actually
about
match
3
whatever I
ml
put in.
of normal
So
saline.
document that and document
I'm
how
going
the
to
patient tolerated
clean.
and I would just
I'm going to unclamp. I'm going to clean my port thoroughly.
and
I'm just going to flush your tubing, okay? That would not happen. That would not happen. Okay, I would not have dropped that. If I did, I would redraw it up and everything like that.
I would actually draw back. I would get 30 mLs back. I would document the color and consistency.
I'm going to aspirate. There's blood, and I'm going to do 3 mLs. I'm going to use the push stop. So, 3. Okay. I'm going to clamp.
Alright. So I didn't miss any safety steps? No. Okay, good.
Okay. I'm going to
1 down, 3 to
hook
go.
up my
I
medication.
have 4 to go.
You want to do this
It's needleless, so I'm doing that. I'm going to unclamp.
They're
I'm
filming
going
it.
to unclamp.
Do you want me to film on my surface?
I'm going to calculate to make sure it's 17 drops per minute. Okay. All right, Mrs. Jones, I want you to ring your bell if there's any discomfort. I'm going to be coming back and checking on you periodically to make sure that everything is running smooth. Do you have any questions or concerns? I'm going to document the length of the tubing, the drug, IV route, dose, frequency. frequency, the drops per minute, any complications, and my patient teaching. Okay, so I'm going to leave. Okay, I'm going to now wash my hands, put on clean gloves, go back into the patient room. Okay, so now your medication has finished, so we're going to
I'm sweating, it's so hard.
clamp. Okay. And a clamp. Take this off. Dispose of, this wouldn't have come off. I'm going to dispose of this properly. Okay. I'm going to use my other 3 cc's of normal saline. I'm going to clean the port. I'm checking for infiltration, any phlebitis. I don't see any of that. Using the ASASH push stop method. I'm going to do half of an ml again, pushing and stopping. This is on clamp. If the doctor would have ordered saline or heparin for clotting, I would administer that now. I'm going to close this off. Okay, dispose of that properly. I'm going to wash my hands. I'm going to document if there was any infiltration or phlebitis, the amount of fluid injected, if the patient tolerated the procedure. I would check back periodically to check for any anaphylaxis, allergic reactions, anything like that. And that is it.